Hello, welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer DeSablo, your host for today's show. Through this monthly program, we bring you information about Franklin County Home Health Agency's programs and services, as well as helpful tips to help you and your loved ones stay safe and healthy at home. I'm very excited to have three special guests with me today. They're going to talk with us about the very beginning of Franklin County Home Health Agency, where the agency's at today, and talk to us about where the agency's going to in the future and how you can help. So I am excited to introduce my guests today, three wonderful women who have done a lot for Franklin County Home Health Agency in our community. I have with me Janet McCarthy, once again, who's been a guest with us many times. Thank you. Janet McCarthy is our current Executive Director. Thank you for being here, Janet.
Thank you.
And Dinny Hawksworth, who has been a former Executive Director and had other roles at the agency as well. Thank you, Dinny, for being here today. And very excited to welcome a founder of Franklin County Home Health Agency, Cynthia Rugg. Thank you for being here today, Cynthia.
Thank you.
Thank you. So your names are familiar, I'm sure, to many people in Franklin County. Could we just give, before we get started talking about the agency and your roles at the agency, can you just introduce yourself and tell us a little bit about your history in our community?
My name is Cynthia Rugg. I was Cynthia Rubley. I grew up in East Berkshire. I graduated from Enosburg High School and went away to nursing school.
Wonderful. Thank you.
When I came home, I had been exposed to a lot of different types of nursing, and I could see a need.
Yes, good. We can't wait to hear more about that as the show goes on. Thank you, Cynthia. So a long history here in our community, you and your family.
Right.
Wonderful. And Dinny, how about yourself?
Well, only 42 years in Vermont, so really an outsider. But home health is where my heart is, and I have really enjoyed being affiliated with it. I actually went to Columbia Presbyterian in New York and then got a master's degree at Catholic University. I served on the Hope Ship in Ecuador, was in the Peace Corps as a rep for a while. But home care has always been my focus and my interest because for me it epitomizes all the good things about nursing and the breadth and depth of what nurses can do.
Mm-hmm. Wonderful. Well said. Thank you, Dinny. And Janet?
Well, I am trained as a registered nurse, and throughout my training I had many opportunities to work on projects or get involved in community health nursing, and it was always a very strong interest. And when I went to work after graduation, I was always very, very interested in working with patients who are getting ready to leave the hospital, and so I had many opportunities to work with the visiting nurse associations throughout Vermont in that role, and that was actually one of the ways that I met Dinny many years ago. And I found my way to Franklin County Home Health 25 years ago. It doesn't seem possible, but it's really great to work and live in the community and be part of this fabulous organization.
Wonderful. And that's something we hear so many times is so much of our staff, if you've told us before, they have long history, long longevity of many of our staff members. So it's really speaks a lot to what it feels like to work in home health care. It's wonderful. So let's talk about the history as we're bringing on a founder today and former executive directors and yourself. You've had 25 years here, but let's go back further and talk about the beginning of home health care in Franklin County. Who wants to tackle the beginning story?
I will.
Yes, great.
In 1968, I was not working at the time, and I was very dear friends with Ada Johnson, who was a public health nurse, and she was my school nurse. She used to come to the school when I was growing up. And she told me about a fund that Medicare had come into effect, and there were funds each state got for home health agencies. And because I've been exposed to public health nursing, which I really liked, I thought, we can do that here. So I asked one of my friends, nurses friends, Norma Walgrove, who also worked at the hospital with me, and she was home too. So I said, let's try it. So we got together, made a plan, met with the medical staff, and Ada helped us get the money from Montpelier, and we set goals. We wanted 14 people to represent every town in Franklin County, and we had a board of directors, and that's how it started.
Started with being home, seeing a need, and really just women getting together with a dream and making it happen. I think that's such a great beginning to our agency.
Because I could see patients leaving the hospital, because I was the supervisor at St. Albans Hospital for quite a while, And what did they do? They needed help. And home's the best place.
Wonderful. Sure
And I think one of the things that's just so striking is that early vision. And who would have thought that we started back in 1968 with this little pot of money and 2 staff members, I think Cynthia shared with us, to where we are today, serving over 1,500 people in our community each year, 75,000 visits last year with a staff of 200 people. We have a second office in Enosburg to serve the residents of the northern part of our community. And when we started with just home care. And now we've evolved and we have many integrated programs which really help to keep people at home, out of the hospital, out of nursing homes, do some wellness and prevention to get families off to a great start. And it's just phenomenal where that early vision started and where we are today.
You were saying before we started you couldn't believe it's been 45 years. Did you envision this breadth of service when you began?
No.
Yeah.
But I knew there was a need. It's just like years ago we had dirt roads, and my grandfather always said there's going to be blacktop someday. Yeah. Well, it's the same idea.
Absolutely. And Janet talked about that growth in service. When we started, you mentioned having 2 nurses, and as it grew, other programs have come in. Ginny, I think you can tell us a little bit about that, having been one of the first former executive directors, and the growth of programs.
Well, growth is the operative word because so many things happen. I mean, in the 4 or 5 years as we started, we moved 3 times because we kept outgrowing offices. And of course, having a satellite in Enosburg was really critical too, because we felt there was too much just coming out of St. Albans and we needed to expand and cover the whole county. And it helped to have board members from every town in the county because that got the word out about home health. I think the kinds of things that I've seen that have made huge differences is first the aging of the population. So demographics have fed into the growth of home health. Secondly, the shorter hospital stays and the importance of getting people at home where they certainly feel better, and their home cooking does a lot more than institutional food. And then the support of family members is so critically important. So when you're taking service out into the community, it's not just nursing, it's home health aides, physical therapy, speech therapy, so many different occupational therapy, so many different professions that have unique skills to take in to help family members and of course the patient who needs the help. So our focus on rehab has been very important. And then I think we've also seen a huge change in prevention. I mean, I think we started blood pressure clinics since cardiac disease and hypertension have been major issues. Foot care clinics, flu clinics. I mean, look at what we've done over the years and how many people we've served. In my time, I saw some different things happen, competition from for-profit agencies, going through certificate of need programs and having to deal with the state at various levels. Then, of course, there was the Vermont Assembly of Home Health Agency, where as visiting nurse associations and home care deliverers, we felt a need to band together so that we could have our voice heard in the legislature and elsewhere. The development of the Homemaker program and going back to the legislators every year to try and squeeze a little bit more help out, realizing that activities of daily living and being able to accomplish them are what really can keep people at home, whether they're living alone or whether they do have a family support system. So the next big break came when the hospice program was developed first in the United Kingdom at St. Christopher's in London, and then of course the palliative care unit at the Royal Vic in Montreal. Finally, Medicare got a conscience, a social conscience, and there were 26 demonstration projects organized in the early 80s, I believe it was. And we belonged, the Franklin County Home Health Agency belonged to a tier of Lamoille, Essex, and Orleans, Caledonia County, and the Burlington Visiting Nurse Association. And with that program, we were able to develop volunteers who were trained to help at home and to fill in the gaps when family members weren't present, to help people have choices about where they wanted to be when they were facing end-of-life issues. And so hospice has been, I think, the eye-opener for people to pay attention to what the home health agencies and visiting nurse associations are doing. It is a comprehensive program giving support to families as well as individuals and looking at comfort measures and keeping people where they want to be.
Absolutely. It's such an important program. And like you said, so many people will learn of all the other work we do after having an experience that's as intimate as hospice and as special as that. But so we're always trying to share everything that we do, but as well the hospice and the end-of-life care. And how proud we can be that we're one of the, as I understand you're saying, pilot programs here in Vermont or even early in the U.S. Is that
right? Yeah, I think it's just really phenomenal when you think about a little organization, little Franklin County, being one of 26 demonstration sites across the United States. You know, again, thinking about your early days when there was a recognition in the community that there was a need for that kind of care, and our board of directors embraced it. It was very risky, and it was, I'm sure, not without pain and angst to figure out how are we going to deliver hospice services in little rural Vermont.
Well, of course, there was the other aspect of it which always haunts the healthcare professionals, which has to do with paperwork and keeping track and actually demonstrating the effectiveness of the program. So some of the work that we had to do was to keep very good documentation of all that we were doing. And that's kind of a segue into one of the other big changes that I noticed in my tenure, which was the introduction of computers, heaven forbid. So first it was in the financial area and trying to get all our books on computers so that we could have easy access to information, and also it just made for very good record keeping. And I'll let Janet go on from there. But
well, we do chuckle because we recently found some of your hospice data.
Oh, good.
Which was primarily handwritten with a paper and a pencil.
Probably.
With old Xerox sheets and the copy paper. But, you know, and now we would retrieve that data just by pushing a few buttons in the computer. So there have been a lot of changes for sure. Yeah, all of our visiting staff use an electronic health record. We were one of the early adopters in the state of Vermont to have the home health agency use a laptop as they go out to make visits, and that allows us to have real-time information. So we've improved our communications, improved a lot of our systems that we would not have been able to do without that technology.
I do sometimes wonder where all that data goes and who analyzes it and how it will affect us in the future as we look at prevention and long-term care. Because there's certainly a need to analyze the data and look at not just the clinical issues, but some of the social issues as well.
Well, and that data actually has become very important as we look at healthcare reform efforts in Vermont. You know, we used to think about taking care of people one at a time, helping people get better one at a time, but having the availability of data allows us to really look at what's happening in our community. And Franklin County Home Health Agency is very involved with some local efforts to look at how do we improve the health of our community overall, from preventive efforts to you know, helping people to stop smoking and looking at groups of populations, which is really the way to move that needle in improving outcomes for people. You know, there are 3 aims of healthcare reform efforts: lower cost, improve outcomes, and improve the experience that patients have with the healthcare system. And I think we're very fortunate in our community that the hospital and home health and mental health and the primary care physicians and the specialty physicians are working together to be able to use that data in a way that's productive and leads us to a better healthcare system in our community.
Well, I have a sort of funny story. At one point, I was fundraising for the Home Health Agency, and I was told in no uncertain terms, oh, no, this was a long time ago, mind you, that people raise money for the hospital well, did things ever change? Because about 15 years later, the same person who said that to me was having foot care from Home Health, and all of a sudden his vision had changed, and he was very grateful for the fact that there was a home health agency and that people would not only come to the home but also establish clinics for the need.
A real value.
And it was a real selling point. So it was very interesting. Change can happen, and one of the things I wanted to mention too is because healthcare has changed so much now, long-term care insurance is another place that we're seeing some improvements in the funding of home care, and I think that's really important too. And of course the Medicaid waiver has been extremely important, really an outgrowth of the original Homemaker program that we had, and that's another way we keep people at home.
Well, when we think about just even the life expectancy, when Cynthia was doing the work of getting us established, the life expectancy at that time was 65, and now it's over 83. And so, you know, we have extended 22 years of home care services, and we do a tremendous amount of long-term care now, helping people stay at home.
Well, I think it's also important to mention that the towns have recognized the need and have been incredibly supportive every year at town meeting, and home health really has no problems. And that's important because there are people who cannot pay, and it means that the agency has a social conscience and is ready to give service where it is most needed.
Absolutely, and that's a good segue. I'd like to talk about some of the needs the agency has and the funding and the way folks can help. But all that you're mentioning, how we're keeping up with the growth and keeping up with the needs of our community, lobbying for changes that need to be made, and all the special care we give, Janet, must take an incredible amount of skilled staff and staff who have the resources to do their job. Can you explain what we do for staff and how we make that happen?
Yeah, so you know, we are very committed to providing medically necessary services to anyone who needs it here, and we do that through our high caliber staff. And you know, we fundraise through the United Way, are very supportive of us. We appreciate the town support that we received at town meeting day, but one of the other ways is our fund development activities, and we're just about to launch our annual appeal, and we've added a new element to our appeal this year in recognition of our founders, Ada Johnson and Cynthia Rugg. We have established a fund specifically and named in their honor to help to support the development of our staff. And so we'll be asking our community to support or consider supporting that fund, and we'll be using those for helping our staff with continuing education, scholarship, training opportunities, some staff recognition, and we're very, very excited about that, and we know that our community would like to support our staff, and we're very pleased that Cynthia has continued her relationship with Franklin County Home Health and has really inspired us to think about how do we really care for our staff.
And you need professional development, especially today. You also need technology. It changes every day, and so you need to improve that to keep in touch outside the agency for the patient, especially the patient, and the nurses and the physical therapists and anybody that's on the road that use computers. You need that connection, and it costs money.
It sure does.
And this is the way we can do it. And you were talking about how the communities have kept in touch. Well, that was started from the very beginning because every chairperson on the select board were contacted and they sent a representation, and that's how it all started. So the towns have been in touch every day, every time that somebody is cared for in their town. You know, they're aware that there is care there and that can be taken care of. And that's what it was all about in the very beginning.
Localized care, caring for your own community. And,
right.
pushing for this. So what an honor to have, as I believe the name is the Rugg Johnson Fund, am I correct?
That's correct.
So an honor to
Very
have
humbled.
that name.
I am very humbled. But I didn't do it alone.
Yeah, talk about the beginning or your ideas about this fund and how that came to be.
At first I thought, well, you know, how are they doing all this? It costs a lot of money, and do they have the financial support to keep up with other private businesses, public institutions, and to keep good, knowledgeable help and keep updated? And I thought, well, you know what, I could start a foundation. And I went to the board and talked to them, and then I went to Janet first and talked to her. And to get a nonprofit set up, it does take a lot of work and takes time. We waited a long time for our nonprofit, for our home health agency, before we could start. So Janet had the idea that, well, you know, you could come under the umbrella of home health and that would be all taken care of, and we'll change it to a fund, a special fund. And this is a restricted fund that people can donate to, and they'll know exactly, you know, what it's going to be used for. So I'm really excited about it. I'm so blessed for people just to listen to me.
It's an honor. We're really so glad that you could come on and share your experience with home health care, and as Janet said, to still be involved all these years of just your heart being in this work, and we really appreciate that, and especially to support the staff. I mean, you've all seen many staff members put a lot of care into the work they do, and to have someone say this needs to be supported and recognized, and I think you'll have a lot of support in the community to recognize that as well. Folks from the healthcare or for people who have that need. I think this is really wonderful. Thank you.
Oh, you're welcome. I'm just glad I was able to do it.
Yeah.
And keep doing it, I hope.
Absolutely. And Janet, your goals for the fund too?
Yes, so we are, like I said, we're about ready to launch our annual appeal, and you know, we're hoping that we'll have a very positive response from the community. That's our expectation, and oftentimes when I'm out and about, people will say, you know, I'd like to recognize specific staff members, or I'd like to have a way to recognize the importance of and value of the nursing assistants that came in and took care of my husband, or the you know, that hospice nurse that was with me during you know, a difficult time in my life, and so we think that this is a way that will you know, help to not only meet our agency needs, but also have a way that individuals can give to something that's important to them and meaningful to them. So we're really happy that Cynthia has been engaged with us and has really helped us to think about how we can make that happen.
Wonderful. Janet, before we close, we have a few minutes left. Bring us up to speed on some of the other activities happening with the agency right now. And since we were talking about hospice and end-of-life care, can you talk about the Start the Conversation program as well?
So within our community, we've been doing a lot of work looking at how do people die in our community, what resources are available for end-of-life. And we realize that sometimes planning for the end of our life and talking about the end of the life are quite difficult. And we plan for everything else in our life. We plan birthday parties, we plan births, we plan pregnancies, we plan weddings, we plan graduations, but we want to really inspire our community to plan for the end of life. And so together with some of our community partners, we're focusing a lot on providing some education to healthcare providers about how do you have those conversations with people. So we have a challenge going on at Franklin County Home Health right now, encouraging our staff to complete their advanced directives. April 17th is National Health Decision Day, so we're really putting some emphasis on that to really be leaders and show how important it is and why it's important. So we've got those kinds of things coming up. We're doing some specialized training for our staff and community members, and planning to do some physician education at the end of May. So that's coming up. We have our Blue Jean Ball, which is one of our famous, it's become one of our famous activities and very important in our fund development. We're knee-deep in planning for that. That'll be in October. Stay tuned. Blue Jean Ball goes to Mardi Gras this year, so it's pretty exciting. But lots of things that are happening. We're very involved, as I said earlier, about creating our future in healthcare, and we believe that home health plays a very, very important part of that, and we see ourselves as being part of the solution for healthcare.
Wonderful. So as we close, just give you a last chance to say anything you'd like to add to the show.
I would just like to thank everybody that's helped from the very beginning. I don't know if I ever really had a chance. There's a lot of people that are retired now that were involved at the very beginning. And if Ada Johnson, God bless her, she just did a lot for us too.
Wonderful. Thank you. And Jenny?
Well, the thing I would say is there's no I in team, and I think that Franklin County Home Health Agency is a really wonderful organization with a lot of teamwork, and of course it has an excellent executive director.
Oh, thank you.
Thank you. Great. It's been a pleasure to have all of you here today to talk about the history of the agency and where we're at now, and it looks like we're going very far, many places. So wonderful. Thank you for the work you've done in our community. Thank you each. And thank you for watching today. If you have any questions about Franklin County Home Health Agency's programs and services or how you can help, please call us at 527-7531 or visit us online at www.fchha.org. Thank you for watching, and be well.
Thank you.